Hi everyone, welcome to my Facebook Live today. I'm Dr. Sally Foote. Today we're going to talk about, and I'm going to demonstrate for you, some less stressful ways to get eye medication into your cat. This is Binks here. You've met him before. Hi you, let's back up a little bit to be better on camera. You've met him before in my previous posts. And I had actually a client contact me asking for some help on how to make it easier to get medication in their cat's eyes. And this is a place where a lot of pet owners struggle, but also even veterinary staff, shelter staff, because many of these cats may have herpes virus infection that causes recurrent, eye inflammation. So a couple points before we even get started putting the medication in our cat's eyes are that we first need to create a space or place that is very nice for our cat to get oral medication, sub-Q fluids, injection, here following my hand, or any kind of ear or eye medication. I am sitting in front of a table that might be counter height, and I've put a blanket or a towel on here. So we want to put something soft so it's comfortable for your cat. Now here's a point. If you've been using a spray bottle to tell your cat to get off the kitchen counters, or to get off of tabletops, etc., do not set that up as your treatment area, because your cat is already kind of upset about that treatment area because they're getting punished there. You need to start off in a place where your cat has not been punished at all. Secondly, then you need to put something comfortable down for them. You can spray it with the feel away so they feel like they've already been there, they've already marked it. If it is their perch place, it has to be, and I'm going to go through the steps of actually putting the eye drops in. It has to be where it's easy for you to get your hands in the right position to put the eye medication in easily and not handling the cat a lot. Because remember, touch is a big trigger for the cats, as well as movement and noise. So a quiet place, minimal touching, and we don't have a lot of background noise going on. Personally, I tend to find places like the utility room on top of the washing machine being handy. I'm just accustomed to standing, when it comes to treatment and care for pets. So we start off with a towel here to make it comfortable for them, and then we may use the towel actually for some ways of holding our cat so they don't paw up at us. Because the reason why we're putting medication in our cat's eyes is often because they have an infection or an irritation, an ulcer on the eye, and it's painful. And it is a normal response. It's called the menace reflex, that when something is coming at the eye, that they back up or they blink and they hold their eyes shut and they want to pull away from it. That is a normal response. So if we have, if we have bruising, if we have redness, an irritation to the eye and pain, they're going to want to withdraw even more. So coming from the side or actually coming from behind, I almost always come from behind when I'm applying eye medication to a cat, is best, so we avoid the frontal approach, and it will decrease that natural reflex to pull away. The second thing is we'll have them on their nice place, and as you can see, Binks is already going into a laying down position, and part of it is because I've had this baby food he loves, that it's easiest for him to eat when he's laying down. And notice how I have my arm. I put my arm around his body with my hand on his shoulder, and my elbow is coming all the way down to kind of his bottom area here. So now my arm is what's holding him. Do not scruff the neck. I'll show you some alternative techniques in a minute, but do not hang on, do not put see, he's already avoiding that. Do not be holding tight. Please do not push their body down. All of this additional touch really agitates the cat. So when positioning him here like so, you can see I'm already coming from the back. Yes, I know. So I'm going to give him a little bit of reward, because if you notice, his tail is starting to flick a little bit. He's like, oh, something's going on. Now this is where you'll need to be a little, dexterous, a little good with your hands. With your hand here, which is helping to prevent him from wanting to jump off the table, I unscrew the cap with my right hand. Practice this. Then I will do one test drop with the bottle. Some of these bottles are really firm. The plastic is hard to push or to squeeze. Make sure you tell your veterinarian if that's the case, because then you'll get everything in place and it's going to be hard to get the drops in, and we may not know. And to veterinary staff, I strongly suggest that when you prescribe medication, you actually take that bottle out, you put in the first dose. The first dose is the most difficult dose to get in. And then you'll be able to test and see how easy is it to squirt out, you know, how easy is it to handle in your hand, because some of these bottles can be tiny. Okay, so I have it in my right hand. Now with my left hand, I am going to take my middle finger right under the jawbone, and that is the only place that I touch the skull to elevate the head. So think about your, I'll show you, my middle finger is going to come here. I don't know if you can see it there on Mr. Binks. Right under, right where you feel that notch right there. And then I just use my finger on his bone. Do not put it underneath here. That's uncomfortable. Please don't grab the head, sorry. Grab the head like that because it's too much handling. And if he was painful about his eye, you're increasing the amount of pain for your cat. So the middle finger here, then my thumb comes just right above where his whiskers are. I know it might be a little hard to see. So let's come a little closer here to the camera, Mr. Big Boy. There. Okay. I have his head up. You see my middle finger here? And my thumb comes right where his whiskers are, and I gently pull the lid back. That's how I get, and I'm holding, his head is going up, so his eyes are naturally going to open, and they're in the correct position for me to quickly drop the drop in. So actually, it's best if you kind of practice once with your cat, and you need to be quick. So once, and then you get some baby food. So then he doesn't mind, you know, being handled like this. He's actually getting a reward for holding still for that second, for that positioning. Okay, now I'm going to do this. I'm going to plop a little bit more in there. This is why I like towels, because then I can wipe my finger off real quick. Let him have a little bit of eating. Again, keeps him completely positively associated with this whole space. Okay, now let me take that away for 1 second. I'm going to middle finger, elevate the head, thumb, the heel of my hand against the other side, one drop, and we're done. And now, hey you. Now, you get your reward. Now, he may need to take a little bit of a rest. If you yourself have ever had anyone else put drops in your eyes, you know how it's that moment. And you do need a few seconds to kind of recover from the surprise of it. So when we do eye treatments for our cats, we need to do one eye and give them a short break of 10, 15 seconds. See if he goes back to eating, that's his way of saying, okay, I'm fine. I'm okay now. And then we go to the other eye. So for the other eye, I'm going to do the same thing, except that I'm going to, again, like I said, you need to practice this. Because I'm right-handed, I'm going to move my hand over and then elevate here with the left thumb, but my middle finger is underneath his jaw, or my fourth finger, and I put the drop in. Yep, and we're done. Did you see how my hands just went literally like this? That's how you take how to remove your hands from the cat. Don't do a lot of rubbing or holding on tight. Literally get them off the cat, because that drop in the eyes is a strong stimulus, and when you do this, now you're removing a lot of touch stimulus to the kitty, and that's what helps them, prevents further escalation up for tension, for withdrawing away from you, or any kind of struggle. And when you're done, now you want to give them again some more food reward, or you might use catnip, but honestly, in my experience, catnip might get the cat more agitated or more active. So I prefer to go with a very, very highly rewarding, highly appealing, easy to immediately eat type food, like tuna that's been mashed up. Some people like the bento flakes. Some cats like the bento flakes. Baby food is Binks's, he loves it. So we'll give small dollops of baby food that way and let him eat it to now be associating good things with the end. Remember that last memory is a lasting memory. Okay, now let's go on to eye ointment. And to do this, I'm going to also show you, well, what if my cat, she kind of wants to paw with her paw, and she does do that little bit of wiggle, and how can I just hold her still? So let's show that when we're going to do the ointment. All right, hang on one thing here, buddy. Oops, sorry. I had to go off camera. I forgot something. Okay, so now I have, put the cat back on this. We're going to do this right. Yeah. Okay. So as you saw, this is a nice thing about using a towel, because then you're always ready. This towel, and you know what I'm going to do? I'm going to back the camera up just a little bit. Hang on, folks. so you can get a better view of the tabletop. As usual, I'm by myself. Oh, playing around with the lighting there too a little bit. Okay, so we have Binks here is on the towel, as you can see. The towel is going lengthwise, and he's laying here. So what you would do is you would get your kitty to lay where the length is perpendicular to the line of his body. Now, he does not like totally being wrapped up in a towel, and I know this, so I'm not going to do that. And sometimes that can just be a lot for you to try to do. So at the very least, take the two towel edges coming up and around his head like so. This is my Rubbermaid, so the towel doesn't slide all over the table. And now using one of those magnetic type of clips that go onto your refrigerator, you're clipping only the towel. Do not clip the cat. I'm clipping the towel, so as you can see, it now shrouds his body. If he were to try to paw, his feet can't get up there. It's kind of encasing his body, but not too tightly. So now I'm going to approach him from the back, and I'm going to use my body close to his. And again, oops, I'm going to take the lid off of here. And what I'm fiddling around with here, I'm going to give Mr. Buddy here a little dollop of food so that he likes having the towel, having the clip on the towel. He sees the cap, he sees the eye medication, and he associates all good things with that. This is what helps to prevent your cat from running off and taking off, you know, when you're trying to do medication. Okay, so I've got him here. His back end is against my abdomen. I'm going to use my abdomen just in contact with him. I am not pushing him down. My two arms are on the sides of his body to help control him. I'm right-handed, so I have the tube of ointment in my hand. I'm going to hold it between my middle finger and my thumb. So in this case, again, I'm going to elevate more with my pinky, okay? And then with my left thumb, I just touch right there at where his whiskers are and do a quick squiggle and then have him blink his eyelids and then I let him go. Eye ointment, I feel, is more difficult to get into the eye than drops. But some of our medications medicate better. They treat better in an ointment form than in a drop form. They may be less irritating to the eye, you know, that initial feeling of the drop, the sensation, as an ointment as compared to a drop. And just frankly, some medications are only prepared in either an ointment format or in a drop format. But all the same, make sure that you're telling your veterinarian and communicating very well what you know, this is quite a bit of, you know, getting things all together here. What can you hold? You know, how can you position the cat? How well can you get this over the eye to get it in? Okay, so we'll do his other eye. On this side, I'm going to use my middle finger to elevate his head. The thumb on this side opens his lid. I make a little squiggle, blink, and we're done. See, I got my hands right away from his head then. Okay, you want the rest of your baby food, buddy? Come here. The point is no struggle at all. We don't want any struggle on these guys. And that. Now I'm making a mess, aren't I? As usual. Now if it's just kind of hard, you don't have a counter or whatever to do, you could set them in your lap, doing a lot of the same positioning. One last way that you can hold them, in a sense, without having any hands on them, is to take like a carrier base or even a laundry basket. And now, I don't know what I just knocked off of there. We can use the laundry basket as a means of containing him. This is good for cats who like to really hunker down, or maybe they almost like to hide. But to have him go in the base of the carrier, and as you can see, now he's curling down in there. So with the carrier, I don't even need to put my arms on either side of him. I could just hold his little head up, open the thumb, drop the drops in, drop the drops in. You could put the food right here so he could eat from that, you know, spot on the carrier. If you needed to even cover him with the blanket as a way of him feeling more kind of secure, you could just wrap the blanket around him like so as you elevate the head and do treatment. So these are some tips or ways of helping it to be less stressful for your cat to receive eye medication. When at times in between in the day, when you do not need to medicate your cat, then I also recommend that you bring your cat up to the spot and that you have, give him some of his treats, give him some of his food, do not do any treatment at all, and then just have him go, get down or take him off of there. So that every time you bring him to the spot, it is not always about treatment and having to get medication in the eyes. Eye problems can quickly become better and they can quickly become worse. So I think it's extremely important that you are reporting back to your veterinarian, whether it's through an email, a text, or a phone call, however, they want you to report back to them on how treatment is going. Secondly, I think using telemedicine consults for like the first 24 hours or 48 hours after treating an eye, when that is an appropriate, time interval, to see how the eye looks, and then for the veterinarian and the veterinary staff to actually watch the pet owner applying the eye medication to see how it's going. Can they get the drops in easily or not? How stressed the cat is. Because if the cat is getting really upset and stressed, stress definitely will cause, especially those herpes virus conjunctivitis cases, to be slower to heal. And if the cat is associating stress with the act of getting medicated, then that will also cause them to be in conflict or in stress just about their owner, any kind of touch or petting with the owner. So communication is really important. I think it's great that we can use technology, things like telemedicine, telehealth consults, photographs. Send your veterinarian maybe a photograph of what the eye looks like, or a quick video of, hey doc, this is how we're doing it at home, what do you think? And the staff can review it. But that's what should help you with helping, medicating the eyes be better and less stressful for you and your kitty cat. Thanks everybody for attending. Thank you very much, Binks, for being such a good model for this. Make sure to subscribe to my YouTube channel. My YouTube channel is drsallyjfoote.com, and I'm going to be sharing these Facebook Lives on the YouTube channel to make it easy for you to go back and review again. You can suggest friends to come to this, the Facebook Live events. I'll go ahead and respond to the comments here when I'm all finished. And then lastly, I have a lot of handouts, videos, and courses for our cat owners as well as veterinary staff on less stressful handling and for home care and health for our cats. So thank you very much, and have a great day. Excuse me, and I'm going to turn this off.